Hi, I'm Rachel Gaskin. I'm 34 years of age, and at the age of 13 I was diagnosed with type 1 diabetes, and pretty much started on insulin within the first kind of 4 to 5 weeks of being diagnosed. Prior to being diagnosed, I was suffering from a lot of these symptoms such as thrush, thirst, drinking non-stop, just like kind of all the things, falling asleep in class at that stage. By the time I was about 22, 23, I developed some severe gastro problems, which at the age of 23 can be deemed quite embarrassing and quite hard to deal with. And at the time I was told that I was suffering from nerve end damage within my gut area, as well as suffering with cases of foot ulcers, osteomyelitis, which means that the infection eats away at the bone, stuff like that. I continued to suffer with foot ulcers roundabout from 2001 straight the way through until I had an operation in 2009. So during that time I was consistently on antibiotics, whether they be oral, intravenously or injected into me. So pretty much for about 9 months of the year, I would say I was on antibiotics. I also developed other diabetic complications such as eye damage, retinal therapy, vessels in my eyes bursting, not being like the bright lights, not being able to see properly with them, reduction in my actual vision. So I pretty much by the age of 25 had all the possible kind of complications you could have from diabetes. In 2007 I was told that my kidneys were beginning to fail, and that the diabetes basically had attacked the kidneys and caused them to come this way. It's never really been mentioned to me that the possible reason for my kidneys becoming the way that they were was more to do with my treatment of the diabetes and my understanding of things that have gone on. When I was diagnosed, there was very little kind of education for my parents or for myself into how things should realistically really be done. So 2007 was diagnosed, and by 2009 October I was called in for a transplant, which is very quick in most circumstances. It doesn't normally happen so quickly. I wasn't actually physically active on the transplant list at the time, but some things happened which meant that they were able to put me forward. One of the reasons my transplant also came up so quickly was the fact that they had put me forward for not just a kidney but a pancreas transplant as well. And it was stated that when you apply for having two organs rather than one, you basically get stepped up. You take priority because you're not looking for one organ at the time. So the kidney was successfully transplanted, and within a couple of days had kicked in, was working fine. However, the pancreas that they tried to transplant, which obviously came from the same person, did not work properly, and they had to remove it there and then on the table, leaving obviously my old pancreas still inside, connected up along with my original kidneys. As they don't remove the kidneys, they just put a third kidney on top. So after my operation, I basically still had the diabetes, still had obviously to manage and try and control that, as well as take on the third kidney. In 2010 I was readmitted to hospital with a fungal urine infection, which basically started to attack my system quite badly. A 2-week stay in hospital soon elevated into a 3-month stay. During the time that I was in hospital, my creatinine levels started to rise, and I was told that it was possible that the infection that I had was attacking the transplant and causing the transplant to reject. However, because the transplant was there, they could not go in and do what they needed to do because of the fear of the infection spreading. I was given a course of what they call immunoglobulin, which is an anti-rejection drug that they pump into your system, which actually has some very, very nasty side effects to it. In the hospital's eyes, it's a very expensive drug, so they try to use it sparingly, I guess, but it's not something that I would recommend anybody tries to have put through their system. So during my 3-month stay within the hospital, I not only had to deal with the infection, which I ended up being on 6 weeks course of intravenous antibiotics. I then had the intravenous immunoglobulin to try and counteract the rejection of the transplant. During all of that, it then sparked off for me severe vomiting, headaches, migraines, fatigue, depression, and just generally just feeling absolutely rotten for days and weeks. After a period of time, the transplant started to settle down and it went back to fairly normal, not as normal as they would like to have been. I believe when I came out of hospital, my creatinine levels were running around 120 to 150 at the time. Whilst in hospital as well with the transplant, the pains of the migraines and the headaches and everything became so severe that paracetamol no longer worked. They then went on to tramadol, which again no longer worked, and eventually got onto a drug called fentanyl, which if anyone knows about fentanyl, you'll know that it's part of the morphine family. It's also 81 times stronger than morphine, which is why it's administered in micrograms rather than milligrams. It is also very close to, and I think this is what not a lot of people know, it's actually very close to being a form of heroin, which was never explained to me at the time. I was told I was being given a painkiller, but I was not made aware of any side effects or any possible outcomes of taking the medication. It was only about 6 months after being out of hospital that I actually realised the implications of the drug fentanyl that I had been taking. So after that, I then discovered that actually I had actually become addicted to the medication. Not only was I addicted to the medication, but the implications of what could happen, especially with the quantity and the doses that I was taking, were very, very high, and were actually could have actually caused me to eventually kill myself had I continued to take the medication. I was aware of the addiction and made the hospital aware of the addiction back in the November of 2010, and I was told to stay with it at the moment and just keep going until everything else is settled down, and then they can start to get me off of it. This then went on to the February, and it actually took for myself to take myself cold turkey before I actually got off of the medication. However, I believe I should never have been put on it had they have understood and realised that it does tell you that the drug is highly addictive and also is addictive, especially if you have kidney and liver problems. Moving on from that, I decided in the late stages of 2011 that there had to be a better way forward with the way I was living, the way things were. I've never been good with medications in the sense of forgetting to take them, not wanting to take tablets too often, so forth and so forth. So to me there had to be a better way. I've always been good with food in the sense of learning about it and just wanting to work with it. And I was made aware of the raw food diet, and started getting myself more involved with making smoothies and juices that would be more beneficial to me. I came across or was introduced to somebody that runs a centre that deals with raw food and natural products and herbs, and just basically, I guess, kind of using food as medicine and just getting your whole body back to being well. I started a program with him which took me through a 30-day process of a smoothie diet. Moving on from there, went on to some fasting and trying to detox and cleanse the body. The raw food side of it, I believe, needs to be developed more, especially with myself, and just finding stuff that I guess I'm more interested in to eat. I've never been a big eater or a great eater, so the smoothies actually work pretty well for me, as long as they fill me up and can keep me going. I can carry them around all day and just use those. I finished the program in March of 2012, and since then I've still been looking for other ways to develop and move forward with my whole diet, especially as I learned that obviously diabetes can be reversed. Moving forward, I want to take that to another level and try to see how I can now benefit myself in getting the diabetes to reverse and getting my whole body into a system of wellness and well-being, being more active, more energy, just being able to do stuff. I believe I've spent far too many years feeling fatigued, and just not having the energy to really do the stuff that I want to do. So I'm hoping, moving forward, that my body will repair itself, and that I will be living proof that you can even reverse type 1 diabetes, and not have to go through the process of transplants and all the medications that try to be put out there. So moving on from today, I'm going to see how we can do that by moving full force forward.